Is withholding antibiotics for a patient with suspected or known infection and signs of sepsis be considered gross medical negligence under intensive care standards? That's a question I'm having today from one of our clients, and I'm going to answer it. My name is Patrick Hotzel, and this is another quick tip for families in intensive care from intensivecarehotline.com. So let's look at the question here again. Would withholding antibiotics for a patient with suspected or known infection and signs of sepsis be considered gross medical negligence under intensive care or ICU standards? Absolutely yes. Withholding antibiotics from a patient with a suspected or known infection and signs of sepsis could be considered gross medical negligence under ICU medical practice. And here is why. It violates standards of care and evidence-based care. Early administration of broad-spectrum antibiotics is a core component of sepsis management. According to surviving sepsis campaign guidelines and standard ICU protocols, antibiotics should be started within 1 hour of recognizing sepsis or septic shock. And I can verify that I've worked in critical care nursing for 25 years in 3 different countries, and I can verify that as soon as you have a patient suspected with sepsis, you start antibiotics. Also, a delay in antibiotics is directly associated with increased mortality. Let's also quickly look at the definition of gross negligence. Gross negligence is more than just a mistake. It's a reckless disregard for the safety or life of a patient. In the context of sepsis, withholding or significantly delaying antibiotics would be without a justifiable reason, i.e. confirmed allergy with no alternative, can be considered a serious deviation from accepted medical practice standards. Also, consider legal and ethical implications. If the patient is harmed or even dies as a result of not receiving timely antibiotics, this may lead to medical malpractice lawsuits, especially if documentation doesn't support a valid reason for withholding. Hospitals, intensive care units, critical care units, and ICUs and physicians are expected to act swiftly once sepsis is suspected. Let's also quickly look at exceptions. The only time withholding antibiotics might not be considered negligent is if the infection is definitely ruled out and symptoms are due to another cause. The patient or surrogate has declined further interventions, i.e. palliative care pathway. There's no documented evidence of infection or systemic inflammation to support a sepsis diagnosis. If you or your family member is facing or suspecting this situation for a loved one, we can help you gather the right questions to ask or draft an urgent care escalation. If you want to know more about that and how we can help you and how we've helped hundreds and hundreds of members and clients over the years, go to intensivecarehotline.com and contact us there on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com. There's more to that in terms of, if you're not starting antibiotics, then blood pressure might crash, septic shock, patients might die. They then would need to escalate treatment further with vasopressors, inotropes. There's a downward spiral that sets off if that evidence-based practice is not followed. So like I said, why am I making these videos? My name is Patrick Hotzel, once again from intensivecarehotline.com, and I've been working in critical care nursing for 25 years in 3 different countries. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that on our testimonial section at intensivecarehotline.com. And you can also verify it on our podcast section at intensivecarehotline.com, where we have done client interviews. Because our advice here is absolutely life-changing. When I talk to clients directly, or when we advise them via email, they clearly always go like, well, we didn't know that. The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. Clearly, that's exactly what 99.9% of families in intensive care are up against. And we are the remedy for that. And that's why you can join a growing number of members and clients that we have helped over the years to improve their lives instantly, making sure they make informed decisions, have peace of mind, control, power, influence, so that their loved ones get best care and treatment always. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. I also talk to doctors and nurses directly. And when I talk to doctors and nurses directly with you or on your behalf, or I set you up with the right questions to ask, you will see that I will ask questions that you haven't even considered asking. And I can counter question depending on the answer. And I can hold them accountable. We can hold them accountable as an organization. That's our skill, right? I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And we also have a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email. And we answer all questions intensive care related. You also have exclusive access as a member to 21 ebooks and 21 videos that I've personally written and recorded that are exclusively accessible only for our members. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Like, comment, subscribe, share the video with your friends and families, click the notification bell. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.